utilizing health information technology for dynamic decision-making. Our goal is to ensure patient-centered, high-quality care for your community that is respectful and responsive to a patient's needs and ideals and works in tandem with clinical evidence, even as infections strain the system. We intend to develop practices for acquisition and processing of health data and utilize health informatics technology combined with ideas that are both intuitive and imaginative, while simultaneously safeguarding that the recommendations do not outpace patient and provider capabilities. Telehealth and mobile healthcare. For high-reliability organizations, complex times require dynamic and collaborative solutions. Over half the adult population in America already uses the internet for health information, and those numbers have increased since COVID-19. Telehealth appointments prevent exposures to suspected infectious agents and achieve similar clinical outcomes without increasing the risk of adverse events. Addressing health equity. Times of crisis can widen the gaps in equity and accessibility to services for marginalized populations. Systems must uphold and maintain social services to help in infection mitigation strategies. Regarding accessibility, time-limited 5G hotspots can be remotely sent to patients with unreliable networks to ensure information sharing with the public, as well as remote distribution of staff and providing best practices for clinical pathways. Some networks are willing to waive certain fees for this use during times of crisis. To ensure process improvements, informaticists can provide targeted, validated patient and provider satisfaction surveys that allow for more focused improvements of these endeavors to guarantee achievement of desired outcomes. Data collection. History has shown that data acquisition and evaluation allow for mathematical modeling and predictive analytics to create epidemic curve prediction, transmission forecasting, to steer implementation of lockdowns and restrictions. This information can guide decision support systems, which provide efficient and effective treatment plans while eliminating superfluous tasks and burdens. Next steps. As the outbreak has put your health system under duress, health informatics and technology can compensate for loss of physical time together. Research has shown that when patients' needs are met, total medical costs are reduced. Our clinical practices and communication must be tailored to our community's needs, with providers making meaningful connections while tech advancements automate practice algorithms, ensure accessibility, and abstract data for future projections. Thank you for your time.
Created using Powtoon.